All right. So good afternoon, wherever you're reaching us from. Good evening, and even good morning, depending on where you're reaching us from. I am Dr. Albert Sedun here. I'm going to be your host for the Weekend Health Talk. This is something I started a while back. I paused, and I've decided to resume and hopefully to continue and do it regularly because of a lot of reasons. All right. So these are my reasons why I'm deciding to do this. And if you're on the call, I just want you to have your attention for some few minutes. I'm not going to take too much. I don't want you to be distracted. I'm going to share a lot of information in a short time, which is going to be beneficial to you and or somebody you might know. All right. So it's very important that we have this session. So one of the reasons why I decided to do this is because of lack of adequate health education in our schools these days. I remember back then in primary school, you would have health professionals come around the schools to give you, health tips, things that you should know of and should teach your parents back home. But these days, it's not that much. If you agree with me, if those days you used to have people come around to schools, and you belong to that generation where you have people coming over to schools, please put in the chat box me. Put it in the chat box me, so I know that I'm not talking to myself. Those days, people used to come around schools to give us free health education to go and tell our parents and for our own health as well. But these days, it's not that common. If you have had that experience before, put in the chat box me. Yes, so definitely, it's one of the reasons why in our schools these days, there are few or no health education. And there is so much lies and misinformation out there. Can't get to the media, social media inclusive. And worst of them is by unqualified personnel. These are people, mostly herbalists and people who have no idea what they are talking about, but just because they are good with the language they speak, they are good orators, they just misinform the entire public. And sometimes people take that as, the gospel truth. People take it hook, line, sinker, whilst those of us who know what they are saying is wrong, most of us are too busy in our consulting rooms and our theaters, and we don't have time to, counter whatever they are saying or educate the public. So I saw a need, an unmet need, which I felt strongly to, step in. And of course, we all know this, that prevention is better and far cheaper than treatment or cure. Yes, there are certain conditions that I'll be talking about that if you could prevent them, it will be far cheaper than if you try to treat or cure them. All right. And of course, even if you have certain conditions, through no fault of yours, if you know how to go about them, you're not likely to result in complications. Again, people have certain conditions that they get misinformed by unqualified personnel whose gospel they take and result in a lot of complications. So again, that's why I'm doing this. Another reason is because of the workload and few posted health workers on the field. There is very short contact time with health professionals, because of the increasing workload. Very short contact time. Now, on the call right now, let me do a simple survey. Those of us who go to hospitals, tell me in the chat box right now, how many minutes you spend with your doctor? How many minutes do you get to spend with your doctor? Put in the chat box right now. Let's do a simple survey right now. The purpose, I know you are good with research, so let's look at here. How many minutes do you get to spend with your doctor? Put in the chat box right now. Because I know that there is a very short contact time. So you don't get to ask questions about your condition. It will not be explained to you what you are suffering, what they are managing you for. You may not even have time to really complain about complications that you may be having. So put in the chat box right now. Put in the chat box, how many minutes do you get to spend with your doctor? Let's do an average now. Put in the chat box. How many minutes do you get to spend? Let me see what people are saying in the chat box. 5 minutes. Somebody says maximum 30 minutes. Somebody says maximum 20 minutes. All right. Somebody says 5. Somebody says less than 10. Somebody says 30 minutes maximum. Wow, a lot of people are having good time. Gifty say 10 to 15 minutes. Somebody says 7 minutes. Let me know how many minutes you get to spend with your doctor. When you go to the hospital, he's in front of you. You exchange pleasantries and you start talking. How many minutes do you spend before you stand and go out? Put it in the chat box right now. Let's have a rough idea. Somebody said 30 minutes maximum. That's a good time, knowing what happens in reality. Let's know in the chat box. How many minutes do you get to spend with your doctor? 5 minutes, less than 10 minutes? Please put in the chat box. That's one of the reasons, because of very short contact time with health professionals. Of course, the excuse we will give you is because of increasing workload, which is actually true. No lie here. Very, very true. Sometimes less than 5 minutes. Cecilia, you are very right. Cecilia is very, very right. Especially if you're a known case, chronic case, we'll be seeing all the time. When you come 2-3 minutes, you're out. All right, patients say 5 minutes. All right. Private hospital, so it's not less than 30 minutes to be fed for them. All right, cool. It's true. It's true. Private hospitals, the workload is not that much. And because you are paying a lot, they get to have more time with you. Definitely, yes. Fatima, you are very right. So the difference is whether it's private or government. All right. So if you state, please let's know whether it's private or government so that we'll be fair to them. All right. Okay. So if you state the time, let's know whether it's private or government. So roughly 5:10, 5:10, 15, 5:10, 15. All right. All right. So another thing is there are a lot of people who are looking for shortcuts. All right. When they have a condition, a health condition, I'll talk about some of those. They just want cure for some of the conditions that have no cure. They want a shortcut to just get rid of whatever it is that they have. So they are so desperate. A lot of people give them wrong information and just dupe them, and that's it. All right. So this is one of the reasons why. These are 5 of some of the reasons why I decided to take this burden upon myself. Lack of adequate health education in our schools these days. So much lies and misinformation out there by unqualified people. All right. Prevention, we all know, is better and far cheaper than treatment, and cure and very short contact time. From what we just did, rough estimate, you realize most people spend between 5 to 10 minutes in the consulting room. And especially if it's government, it's going to be far less than that. If it's private, you might have more time because the workload in private is not that much. But in government settings, polyclinics, you have no idea what happens out there. Somebody rightly says, Cecilia said it's less than 5 minutes. It is true, especially if it's a chronic case, all right? So that is why I decided to take upon myself this burden to give out this free health education. So since we're talking about health, again, please just stick and stay. Don't get distracted. Few minutes, we're going to be out of here, all right? So thank you again. Welcome to everyone. All our new friends who are joining us, welcome. I'm Dr. Albesedo here. I'm here to serve you. So we're going to have a definition of health. What is health? Health, as officially defined by the WHO, all right, is a state of complete, listen, I'll find out for those of us on the call who are healthy right now. It's a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Physical, mental, and social well-being. All right. Now, how many of us on the call right now are unhealthy? It means you have some issues, your emotional issues, you have some social issues, or you have some physical issues. That makes you unhealthy. It's a state of complete. It's absolute. All right. If you don't have money in your pocket, you are not healthy. So if you're on the call, and from this definition by WHO, you feel you're not healthy, type yeah, or type me. I want to know, type me in the comment section right now. Type me, M-E, if you feel you're not healthy, because maybe you want some money, maybe you have some stressor in your life, maybe you have some physical problem. Please put in the chat box ME right now for me to know. If you feel unhealthy by this definition by WHO right now, put in the chat box me, so I know those who are not healthy. If you feel unhealthy by this definition by WHO, please put in the chat box right now for me. Please put in the chat box right now. Yes. If you feel unhealthy, put in the chat box me, so I know you are not healthy. Because it's a state of complete physical, mental, and emotional, and physical, mental, and social well-being, and not just the absence of maybe malaria or typhoid or whatever. So if you in the comment section, please put in the chat box. So let me know if you feel unhealthy by the definition WHO has put across. All right, if you feel unhealthy, yes. So you see, almost a lot of people feel unhealthy by this definition by WHO, and it cuts across. All right, it cuts across lots and lots of people. Now, that is why, sorry. Now, what I'm going to do is just touch on common medical conditions, not all medical conditions, but these are the ones that are very common. Yet today, people go to the consulting room. These are the common conditions they go with. All right, so this is the conditions that I'm going to explain to you how you are supposed to understand it, to know how to manage it, possibly prevent it or manage it properly. All right, so common medical conditions. If you go to any consulting room in Ghana here, almost all the conditions I'm going to talk about are the common issues All right. Apart from, of course, malaria. Apart from malaria, which we all know what to do already with it, these are the other very common conditions. First of all is with our oldies, with our old people, with our parents. The first one, common, the first one is osteoarthritis. Osteo means bone. Arthro means joint. Itis means inflammation. Don't worry about it. We are not in medical school lectures. But this is what osteoarthritis is. I like visuals, all right? So I want to explain to you, when somebody says, or a doctor explains to you that you have osteoarthritis, what do they mean? That is what I'm here for. Now, this is a normal joint, a healthy joint, all right? A healthy joint has the bone here, and the top bone here has a cartilage that surrounds it at the tip. The cartilage is at the tip. And the bone below here also has a cartilage. The cartilage is the bluish thing here, all right? The color, it depends on which school you attend. The color I see here, because I went to Saito, is blue, all right? I don't know which other color anybody else is seeing. Right, so this is the cartilage. So bone is not supposed to touch bone. That's how God created it. Now, so this is a healthy bone. This is a healthy joint where bones meet. It's a joint. So this is a healthy joint. Aside the cartilage, there is a space here, all right? There's a space here that has what we call synovial fluid. Synovial fluid. You can see synovial membrane, synovial fluid. So when you are walking, running, crawling, whatever it is, it glides on itself, on the surfaces like this. Bone is not supposed to touch bone. It's the cartilage that glides in that space smoothly, so you don't get to feel any pain. However, if you have osteoarthritis, what happens is chronic inflammation happens, toxins accumulate in this space, eating away the cartilage, and this is what results in bone touching bone. So what happens is some people, even at rest, they feel pain. When they are sitting, we call it resting pain. You are sitting, our grandparents have it. In the people 70, 80, and 90s, some of them may have it. So the cartilage is eaten away, and then the bone is left bare to touch the bone. So you see that this one, this is what is causing the pain. This one right here. So when we say osteoarthritis, this is exactly what we mean. So the doctor says you have osteoarthritis of this joint, or here and here. This is what the doctor is saying. Wherever two bones meet, that's a joint. So this is what is happening when we say you have osteoarthritis. You see, the cartilage is worn off here. The cartilage has worn off from this side. So the bone is left bare to touch the bone. And that is why you're feeling pain. So the treatment modality mostly is to give you painkillers. And painkillers are not going to treat the underlying cause of the pain. It's helping take care of the pain. But the underlying cause of the pain is the fact that the cartilage has been eaten away. All right. So this is osteoarthritis. Let's go on. So again, this is a healthy joints, and this is osteoarthritis. You see how the cartilage has worn off. All right. So this is what one of the common things that people present to almost every consulting room in Ghana here, whether private or government. The next thing is back pain. Back pain, back pain, back pain, back pain. This can be very worrying. Back pain is major. You know, in medicine, we say pain is painful. Pain is painful. If you are hearing me loud and clear, you are following me carefully, please put in the chat box, pain is painful. Pain is painful. No one deserves to be left to be in pain. No one deserves to be left to be in pain. Pain is very painful. The fact that you are growing old doesn't mean we should leave you to suffer pain. No, that aging shouldn't be equated to pain. No, we will not say because she's a grandmother, he's a grandfather, or he's old, so he's in pain, no problem, we understand. No, we don't understand. We don't understand. We will not understand. Why? Because pain is very, very painful. Now, back pain, as you can see, mostly lower back pain here. Lower back pain. We are here to talk about what? Prevention, understanding the condition, and possibly preventing it. All right. So pain, lower back pain especially. What causes it? Most often it can happen from, of course, accident can result. That can lead to changes in the spine. Then the space between them, the disc can herniate as it come out, get broken, and then the bone above the vertebral column is pressing on the other one, And in the vertebral column, what makes it very dangerous is there are nerves coming off the sides that supplies the whole body. And once the bone is pressing on that one, it causes other issues as well. Now, one of the things that we do to cause this chronic back pain is because of our sitting posture. Most of us sit for long hours at work. For example, as you can see, I'm sitting in a swivel chair right now, and I'm sitting upright. There is something behind me to help me sit upright, all right? So I've placed something behind me, this one, behind me to help me sit upright. But most of us may not do that. So you sit like that for a long time, you get to distort the architecture, the normal architecture of the spine. And when that happens, the pain will start small, and then just persist and get worse over time. Now, when it persists over time and it becomes complicated, you may have to sometimes do what we call decompressing surgery. You have to go and decompress that because the vertebral column is compressing on the nerves and the architecture has been distorted. So, and all that happened because of our wrong sitting posture. Now, if you're on the call right now and you are a culprit of sitting like this, or with your neck, because we're all using laptop, ideally the laptop is supposed to be at our eye level. Another problem. We're supposed to sit upright. Another problem. Most of us don't do that. So if you're a culprit to sitting wrongly at work, at home, or wherever, put in a chat box me. So I know I have people who agree with me. All right. All right. So yeah. So put in a chat box if you agree with me that you are a victim of sitting wrongly, either at work or at home or wherever you find yourself. All right. Put in the chat box me, so I know there are people who agree with me. Yes. If you can hear me loud and clear, and you agree with me that you are a culprit of sitting wrongly at work. So you sit like this, or on the sideways, and by close of day, you begin to feel some discomfort in your spine area. Put in the chat box me, so I know there are people who are willing to learn the right thing is to sit upright. If the chair is not designed such in an ergonomic way, put something behind you. There are things to buy to support your back. It's very important. Why? Because you're going to be doing that for the next 5, 10, 20, 15 years. And that complicates and compound the issues. All right. So we need to sit upright. We need to know how to put things at our eye level so that we stop doing this, putting pressure on the neck column. All right. So that's another thing. So osteoarthritis. The next we're talking about is back pain. This is it. Like I said, pain is painful. Pain is painful. Mostly it's the lower back pain here. The next thing that is very common, again, among the elderlies in the past, but these days, it's in the early 20s now. We are getting a lot of young people with high blood pressure called hypertension. Young people. Now, and of course, it's brother. Now, why are a lot of people developing hypertension early? The stresses of life, poor and unhealthy lifestyles, and sometimes it's genetic. Now, when you talk about hypertension specifically, in medical term, all right, 90% of the time, we don't know what is causing the hypertension. We don't know in 90% of the time what is causing the high blood pressure. It is only in 10% of the time that we know what is causing the high blood pressure, mostly from the kidney and from adrenal gland and other places. But in 90% of the time, we don't know what is causing the hypertension. However, we know how best to help you control it. Now, nobody wishes you to have high blood pressure. So as long as you have blood pressure reading of 140/90 and above, more than twice the reading at the hospital of 140/90 and above at the hospital, after you've gone to sit down and rest for about 5 to 10 minutes, and they check your blood pressure reading, and it's more than 140/90 on 2 occasions or 2 times, you are more likely to be diagnosed with high blood pressure, which is hypertension. So please, 140 over 90 and above. If you are hearing me loud and clear, put in the chat box, 140 over 90. I want it to be an interactive session. That's why I'm giving you this small work to help me with. 140 over 90 and above. Once you have that reading, don't say, I reject it, I rebuke it, it's not my portion. Nobody wishes it on you. But if you are diagnosed, you have it. Now, what we wish for you is early diagnosis and secondly, compliance to treatment. If you don't comply to treatment and you go using herbal preparations, you just go to prayer camps and everything else, you are likely to have complications of the hypertension. A lot of complications. Heart attack is one of them. Your kidney can damage is one of them. Of course, something I'm going to talk about, stroke can result from it. Yes, I am aware some of the medications that are given has certain side effects, but mind you, no doctor prescribes any medication to you or for you because of its side effects. We give you the medications because of its therapeutic effect, the benefits to you. That is why we give you those medications. So if you're having some side effect, you need to get back to your doctor and report so that we need to do the necessary changes. If you have complications or side effect for any prescribed medications, get back to the hospital and the doctors know what to do. Do not just stop the medication and say, I'm fine, so I'm stopping. No, don't say complications or side effects, so I'm stopping. No, don't say, somebody say it is spiritual. I am not saying spiritual issues don't exist. What I am telling you point blankly is there is something called hypertension. You can pray, you can do every other thing, but I'm saying if you are put on prescribed medications, take them. If you are diagnosed hypertension and the doctor recommends medications for you and changes in your lifestyle, please just comply. I am not saying don't pray. I'm not saying don't do what you're supposed to do, but I'm saying if you are on medications, take the medications. Why? Because when you have complications, to treat you of those complications is about 10 times the cost, if not 100 times. It's about, it can even be 100 times because the cost of the blood pressure medications is about from 50 to 100 cedis a month, maximum, maybe. About 50 to 100. Anybody knows the cost of blood BP medications? Rough estimates that you bought recently, put in the chat box so that we all learn. How much do you spend on your BP medications monthly? Put in the chat box so that people know what I'm talking about. Now, that cost can be multiplied by 10 or even 100 if you begin to develop complications. Once you begin to develop complications, the cost of you to treat the complications is about 10 to 100 times of that. Is that what you want? No. Don't listen to people who don't know what they are talking about and they are just telling you certain things out of sympathy. All right? Do not over spiritualize health. I'm not a pagan. I'm not someone who doesn't believe in God, but I'm saying God gives the wisdom so that we treat ourselves as well. Complications can be very, very serious if you ignore healthy lifestyle, if you ignore directives from a qualified doctor. I'm not talking about herbalist or spiritualist. No, I'm not talking about herbalist or spiritualist. So poorly controlled hypertension can lead to a lot of things: heart attack, eyesight problems, kidney damage, stroke, lot of other issues. All right. So whatever is the case is, if you are recommended on medications, please make sure you stick to it. Thank you very much. So first of all, early diagnosis, compliance to treatment, follow-up reviews. Now, most often when people come to the hospital, most people have never had any health screening before. So let's develop the habit of regular health checks. It doesn't cost too much to enter a pharmacy shop or go to the nearby clinic to have your blood pressure checked. It doesn't cost too much. Just so you know your blood pressure reading, because if it's 140, 90 and above, you know there is a problem, especially if it is in your family. If there are other people in your family who have it, you stand a very high risk of having it as well. The most common risk is that you are black. I'm black. Being black is one of the high risk already. All right. So if you have it in your family, it's another risk. If you are working under a lot of stressful conditions, another risk. If you are living a sedentary lifestyle where you sit at one place for long, it's another risk. That is if you exercise very little or very less, it's a risk. All right. So these are the things you should look out for and be careful and listen to advice. Again, I'm reiterating, Herbalists, spiritually, they have no play here, please. They will tell you all the nice things you want to hear about how they are going to cure your hypertension. There is no cure for it. But doesn't mean you're going to be sentenced to lifelong medications. What it means is that you can have medications and have optimal control, where you have the hypertension, but you may even be put off medications after some time. But you are still a hypertensive. You are still a known hypertensive. But you may be just on one medication, very low dose, but you are still hypertensive. So there is no cure. Don't be deceived by anybody. No grandfather, grandmother tales. No. All right. The next one is diabetes. Very common. We all know that most often than they go hand in hand. This one as well. Early diagnosis, compliance to treatment, and follow-up visit is very key. You have any complications on the medications or the condition, report to a qualified medical professional. Don't say, I've been taking your medication, I've been taking these big medications, the diabetes medication, and it is not working, so I'm going to try the herbals to see. Because my grandfather said he used the herbals and it worked for him. You have no idea. Diabetes can lead to poor eyesight complications. And those of us on the call, if you are a man and you are on the call, please put in a chat box MAN. If you are a man, you're on the call, put in a chat box MAN. If you're a man and you're on the call, put in a chat box MAN right now. If you're a man and you're on the call, put in a chat box MAN. If you're a man and you're on the call, put in a chat box MAN. If you're a man on the call, put in the chat box MAN. Yes, I'm going to talk to the men right now. The men, it will interest you to know that if your diabetes is poorly controlled, your manhood is going to lose its function. I'm talking to the men right now, and even the wives, because sometimes the wives, the thing interests them more than even the men. For the men, I'm talking to you right now. If your diabetes and your hypertension is poorly controlled, your manhood is going to begin to lose its optimal functioning to the point where it can lose total function. What I mean by that is, we are all adults on the call, so I'm going to say outright, your thing will not be able to get up again. You will notice that you don't have the early morning glory. If you understand what I mean by early morning glory, put in the chat box right now. If you understand what I mean by early morning glory. See, in the morning, it's not only the sun that rises. If you are a man and you wake up early morning and it's only the sun that you see rising, there is a problem. If you don't understand what I mean by early morning glory, put in the chat box right now. If your diabetes, your hypertension is not properly controlled, you're going to lose that early morning glory and you may even lose total function. So don't let any herbalist, any spiritual deceive you. All right? So you need to get it under control. Get it under control. It's very, very important. For the men on the call who know what I'm talking about, put in the chat box early morning glory. It's very important. So diabetes, again, early detection, compliance to treatment, very key. We need to know, we need to understand if you have any problem, any issue, please speak to a doctor. If you speak to the doctor and you're not comfortable with how he or she is treating you, please, you have the right to seek second opinion. You have the right to seek second opinion from another hospital, whether private or government. You have the right to do that. So please, diabetes and hypertension. Again, if it is not properly controlled, it can result in this other condition. High cholesterol levels, they are triplets. Hypertension, diabetes, high cholesterol level. Again, this one, it's mostly from our habits. Eating, no exercise. That is where the problem arises from. All right. So the three go together. And if they're all not properly controlled, again, this one has medications. All right. Don't tell me you're just chewing leaves and you'll be fine. No. Don't say your grandfather lived 100 years and this is. See, when you go to the villages, the air they breathe is better than the air we breathe right in Accra. The water, the food they eat is fresh. We eat refrigerated, we eat frozen food, we eat junk, we eat fast food. They eat fresh cassava from the farm for the fufu. Our cassava we eat here, the chicken we eat here has been killed in whichever country for the past 5 years, has been kept frozen. You are going to even prepare in the 10th year. So these are the issues surrounding our health. All right. Now, this is what it might result into stroke. Trust me when I say this. If you come to Kolebu, the stroke unit is almost always full. The stroke unit in Kolebu is almost always full. And what is most worrying is the fact that when you enter the ward, very young people come down with stroke. In fact, when you talk to almost everybody on the stroke unit, they will tell you, I was diagnosed with hypertension, diabetes. I was diagnosed. I started taking medications, and at the point, I stopped. If you ask them why, somebody deceived them along the line. Somebody told them, oh, the doctor's medications, please, you're going to, no, you become too dependent on it. Without it, you can't function. It's not good for you. It's all lies. These are unqualified people you shouldn't even listen to. So stroke, there are two types. We have the hemorrhagic, where the vessels will burst, or the ischemic, where there's blockade. So blood supply to part of the brain is cut off. It's cut off in these two main ways, all right? Where the vessel supplying the part is what? Blocked, that's the ischemic type, or it ruptures because of poorly controlled diabetes or hypertension. Now, the one that is most dangerous, right? Who knows the one that is most dangerous among the two? The hemorrhagic stroke and the ischemic stroke. Who knows the one that is most dangerous? Who knows the one that is most dangerous? Who knows the one that is most dangerous? Just put in the chat box right now. Hemorrhagic or ischemic? Who knows the one that is most dangerous? Just put in the chat box. The next 3 seconds. 1, 2, 3, and I'll go. Who knows the one that is most dangerous? Put in the chat box. If you can hear me loud and clear, put in the chat box. I like Mabel Onuma saying the best one. Yes, that's a hemorrhagic stroke. It can kill you instantly. The person just comes down with a stroke, few minutes, few hours, even to the hospital, the person will just die. It's very, very dangerous. Very, 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 very dangerous. The hemorrhagic type. Very, very dangerous. You don't want your mother or father or uncle to have it. Why do I say this? Because the cost of treatment is very expensive. Imagine your salary is 2,500 and you're going to be on your mother is going to be on a stroke unit and you are paying about 150 to 200 Ghana cedis daily while she's on the ward. A day you are paying about 150 to 200 Ghana cedis. Let's assume 150 to 200 Ghana cedis. A week is 1,004. Your salary is 2,500. You are the daughter or son of that woman. You are supposed to take care of her. You cannot even eat. I'm not talking about the transport, the feeding, the medications. So you want to prevent this. How? Make sure if they are diagnosed hypertension, diabetes, make sure they are on medications and they are compliant. Let them complain all day, all night. Explain to them they need it for their own self. If you are diagnosed with it, make sure you remain compliant because nobody even knows the level of blood pressure high that may result in it. It can happen to anybody, maybe 160, 90, 170, 100, 180. Nobody knows. They are all different. So your aim, early diagnosis, compliant to treatment, and you are good to go. Exercising is good. 30 minutes, at least 3, 4, 5 times a week. Very good. Something that makes you sweat. If you're on the call and you do regular exercise, please put in the chat box me. Let me celebrate you. If you're on a call and you do regular exercise, which is very good, regular exercise allows blood to flow to every part of your body. Very, very good. If you're on a call and you do regular exercise, let me celebrate you for the next 3 seconds. Ebo, well done. Cecilia, well done. Anyone else who does regular exercises? Joe, Fringe. Oh, Fringe, I'm the officer there. Mufaro, well done. Liana, well done. It is very good to do regular exercise. It is cheap, it is inexpensive, it is doable. Regular exercise, especially weekends. Weekends, I know we are all busy, but if you are busy and you go and die, somebody will continue from where you left off. So make sure, yes, home exercises. Wilma, I get you. All right. And Madam Pauline also, well done to all of you. So that is stroke. These are the symptoms. But this may be a bit, this may be a bit confused. So let me just simplify it for in medical school. What you learn is a lot. So we try to find ways and means of remembering, huge data. This is how we remember it in medical school. FAST. If you are seeing the slide, type fast. FAST in the chat box. If you are seeing the slide, type fast. So these are the symptoms of stroke. One side of your face is drooping. That is, you see the person's one side of the face is drooping. All right. And the other one is arms. The arm become weak. One of the arm is becoming weak. Speech. The person's speech will become slurry. It's not be clear. When the person is talking, it won't be clear. And of course, they put a T there, it's a time to call for ambulance because it's an emergency. You see somebody, one side of the face is twisted, the arm is weak, my brother, my sister, and the speech is slurry, there is a problem. There is a problem. The person may be coming down with stroke. The person may be coming down with stroke. It is not witchcraft. It is not because he went to the village and returned recently. That is why. It's not because he went to a funeral of somebody who, whatever, and he returned recently. No, that's not why. It's not because he went to the marketplace. No, it's because the person is coming out with a stroke. And most likely when they check the blood pressure in the hospital, it's going to be in the 200s or the 180 or over 110 or 120. It's not because of witchcraft. We have over-spiritualized everything. We try to explain everything away. In the past, when knowledge was very limited to our people, they used to explain everything with superstition. But now, knowledge is available. However, most people are not even aware. You have very educated people who are being advised by, excuse my language, illiterates to do herbals, not approved by FDA. Please. So these are the symptoms. Your face, your arm, and your speech. You notice that there are problems. So stroke is what you want to avoid. Stroke is 100% preventable. Those of you who believe and who agree with me that early detection, compliance to treatment, and regular reviews will help us all prevent stroke, put it in the chat box right now. Stroke is 100% preventable. Stroke is 100% preventable. Let people know. You have your mom, your dad, your uncle, your brother, whoever, or yourself who is diagnosed with hypertension, diabetes. Please, you don't want to end up spending over 5,000 monthly on stroke treatment on the ward. Because when the person comes down with stroke, they're going to spend at least 2 weeks on the ward. They're going to spend more than 5,000 while they're there. I spoke to someone who told me he spent about 15,000 Ghana cedis on his father when he came down with stroke. Why? Because he refused to take medication. What was he doing this time? He says he's praying about it. It doesn't mean God doesn't listen, no. But God also asked you to be wise as serpents. God gave the wisdom for the medications to be discovered and produced for your use. Did you wait for God to come and put food in your mouth? No. Did God cook the food? No. So why are you eating the food that God didn't cook? Now you are sitting in a chair. Was God the one who produced the chair? No. Humans. So let's think about it. Don't over-spiritualize things and complicate your own life. All right? So stroke is 100% preventable. Yes, it is. So let's know the common things that cause a stroke: poorly controlled hypertension, diabetes. Let's prevent it. Now let's go to neuropathy. This is the one that has a lot of names. If you can hear me loud and clear, put Anansi in the chat box. Anansi. This is what a lot of people call Anansi. You know, Anansi. And it's like, how can Anansi catch your fingers and your toes? You know, what is neuropathy? It's a damage or dysfunction of one or more of your nerves that typically results in what? Numbness, tingling, muscle weakness, and pain in the affected area. This is what they call Anansi. This one, how do you call it in your dialect? It's called Anansi. In Ewa, we call it Ayi Degao. Ayi, we call it Ayi, the same Anansi, you know, spider. In your tribe, in your dialect, what do you call it? Neuropathy is called Anansi in Akan. Ayi in Ewa. I don't know how they call it in Ghana. So put in the chat box how you call it in your dialect. Neuropathy. It's very frequent. It starts in your hands and feet, but other parts of your body can be affected too. It's because of nerve problem. So this is what it is. This is what they call Anansi. And people who are highly educated will believe, oh, Anansi actually means it's not true. It's neuropathy. I want to know how you call it in your dialect. Ayi, yes. Somebody say ayi dega, yes. Anansi, good. Ibrahim say Anansi. Madam Police say ayi, yes. We have Anansi. I want the Gan. How do you call it in Gan? In Gan, Dagbani, in whatever, which of the dialects? Please, how do you call it? This is neuropathy. You need to know this. You might never have heard anybody explain to you before, but this is neuropathy. Or this is neuropathy. In your dialect, how do you call it? How do you call it in your dialect? Neuropathy. Now, neuropathy is because of the nerve problem. And you see the central nervous system, the brain and spinal cord. This one is a past question, GSS. Brain and spinal cord. Now these are the nerves. You see how the nerves are coming off the spinal cord? So when you have poor sitting posture for long, the poor sitting posture is going to result in the vertebral column compressing on those nerves. Now those of you who have sciatica, pain at the back of your thigh radiating to your ankle, is because of the nerve that radiates from that part all the way to this place. It's called a sciatic nerve. The compression is happening at the top, but the effect is felt there. You take a lot of things and you don't see the ring. You have to go to the root cause of the problem. If you are diabetic, it can affect your nerves very quickly. You will know if you feel sensations in your fingertips or your toes, or sometimes for diabetics, sometimes they walk like if they are walking on foam, as if they are walking on foam. The nerves that supply their feet are damaged. So when they are walking, they're not able to sense and determine where they are positioning and all that. So it's like they are walking on foam. And a diabetic that is poorly controlled can actually leave his or her home and walk barefooted to a friend's house without knowing that he's not wearing slippers. Or may leave home with their slippers, but the slippers may come off during the journey and they may not even realize it because they've lost sensation in the feet. That's how serious. That's why I specifically brought this diabetic neuropathy. As you can see, the areas of the body that it can affect. All right. Now, let's go to the symptoms of peripheral neuropathy. What do I mean by peripheral? Peripheral is from here. From all these things that you see, all these ones are the peripheral nerves. All right. Let's not go to. So how does it present? Unusual sensations. And you try to explain it away with witchcraft. You say it is because of witchcraft, because of your auntie, your mother, your brother. I'm not saying witches don't exist. Anything that has a name exists, all right? Even ghosts, as long as it has a name, it exists. So I'm not saying it is the cause of, no, I'm saying let's use medical knowledge to explain it. Pain from light touch, so hyperesthesia. I touch you and you feel the pain too much than you're supposed to. Muscle cramping, muscle pull. You can give 10,001 reasons for a nerve has something to do with it, all right? Twitching, and as you can see for my men, can you see on the far right that your manhood can lose its functioning from nerve damage? Manhood can lose its function from nerve damage. Why am I concerned about the men? Because I'm a man. Why am I concerned about the men? Because the private part of women is not called womanhood. The private part of men is called manhood, because that is your real self down there. That is your real self down there. Once you lose that function, trouble. When a child is born, they leave their child and see what is in there. When they see what is there, they call it's a boy or a girl. So for a boy, a man, that is your real self. So you need to make sure your real self stays real. If you understand, if you get it, you will get it. All right, now let's go to again. I'm on the men again. So we've talked about what? Osteoarthritis, back pain. We talk about hypertension, diabetes, chronic, high cholesterol levels. We talk about stroke. Now we're talking about prostate enlargement. I'm again on the men. It's common. Men are about 40 years. It's going to happen. It will happen. The advice is you try to prevent it. All right. Now, it's prostate enlargement. This is a normal prostate. Again, take your time and listen here carefully. So this is a normal prostate that is on both sides of the urethra, where the urine comes off from the bladder. This is a bladder. Okay, from the bladder, this is it. This is where the urine comes off from the bladder. It goes to the urethra like that. Comes out nicely, beautifully. Women don't have this one. So this one I'm talking to only the men. If you're a man on the call, put man in the chat box. Put man. Put man in the chat box. Put man in the chat box. So now I'm talking to you. After 40 years, it will happen to you. It will happen. I know that. All right. So the prostate is on both sides of the urethra. This is a normal version. As you age, again, toxins and inflammatory processes will make the prostate begin to enlarge. Now, if the toxins and inflammatory process is quite fast, right? The enlargement will be very fast and it will encroach on this space. When it does that, that's when you begin to have certain symptoms in a man. So prostate enlargement can result in certain symptoms. Again, let's look at it this way nicely. This is how it is. We call it BPH, benign prostatic hyperplasia. For you to understand it, prostate enlargement. Don't kill yourself. It's called prostate enlargement. Don't worry yourself. You're not in medical school. It's called prostate enlargement. Okay. Now, when it enlarges, you see, it is encroaching on the space where the urine is supposed to flow naturally. That is why if a man has prostate enlargement and it becomes complicated, most of our fathers and grandfathers, they may have to put something inside we call catheter. The catheter is placed, hopefully, to bypass this obstruction to get here so that urine flows through the catheter outside. Now, it can be so worse and acutely happen that we call it shamoba, junsomba. Like the urine is not coming acutely, and the urine accumulates here and becomes severely painful. Very, very painful. So that wise, we have to go to the top, suprapubic, to make a way for the urine to come out, to relieve you of the pain. Whilst we try to see what we can do to help you. There are people who are living perpetually with a catheter in their manhood. Again, if you have catheter in your manhood, my brother, you don't like it because it means the main function, the other function of your manhood, you've lost it. Is it the main function or the other function? You choose. But I think it's the main function. That's what I think. You've lost the main function. There's a catheter in your manhood. You can't even do what you're supposed to do, again, as a man. So you want to do things that will make sure you prevent this enlargement, this period. Now, these are the symptoms you got to experience. It comes with explanation. Take a screenshot or follow me as I explain to you. Frequency. Once the prostate is enlarging, and because it's encroaching on that space, there are mechanisms that can explain this, but we are not medical school lectures. So let me just explain to you. Frequency, you'll be urinating very fast. Small time you're going to urinate. So, so small you're going to urinate. Especially, let me give you a special example. If you're in a journey from Accra to Kumasi, a 5-hour to 6-hour journey, every 1 hour, somebody says, I want to urinate. The person is in the early 40s or late 40s. Most likely the prostate is enlarged. After 1 hour, they want to urinate again. Or when they are sleeping, nocturia, they wake up about 3, 4, 5, 6. Some people wake up 10 times to urine, prostate enlargement. Incontinence, inability to control your urine. You know, when you feel like urinating, you have a control that comes from your, higher up to tell you, no, wait, it's not the right time, it's not the right place. Let me hold it. But when the person is not able to, incontinence. Urgency, when you feel like urinating, you cannot postpone it. Like you have to do it now. Such that an elderly person can be at a funeral, at a wedding, at a party, and urinate on himself because there is no place of convenience. And he's among people, and he just has to urinate on himself because he can't control it. He lacks the control. That's urgency. Now, there's something called hesitancy. Hesitancy is the old man goes there to urinate, and he has to wait and relax all his muscles before the urine begins to come one small. There's a delay before it starts. All right. There's training whereby you have to push. When you are constipated, what you do, there's exactly the same thing. You strain, you push it before the urine comes out. And there's weak stream. This is the fun part. Boys, men, as we are, boys, when you're a boy, you can urinate and hit the roof. If you're on a call and you've ever tried to use your urine to hit the roof or the wall, please put in the chat box me. This one again, I'm talking to the men. If you're on the call and you've tried to use your urine to hit the wall, or you've competed with other people to see how far your urine will go to land, put in a chat box me. Sometimes you need to hit the roof. Your child, boy, 1 year, 2 years, when you remove the pamper, the urine is up like that. Those are fun times. Let's say, and it's true. Those are fun times. If you've done that before, put in the chat box me. I've done that as a boy. But when you have prostate enlargement, you're going to have what we call weak stream. Weak stream. That's your urine instead of going like this, it just drops like that. Weak stream. Intermittency means that you urinate and it stops. And has to stop. You strain and it comes again. It stops. Midstream, it stops. And comes again, it stops. These are all signs of what we call lower urinary tract symptoms. Incomplete emptying. You finish urinating, but then you feel there is more left over. Once you're having this prostate enlargement, then we have something called post-maturation dribbling. We are blessed with an organ whereby when we finish urinating, we are allowed to, to shake it and everything drops off. But when you have prostate enlargement, no matter how you shake it, when you put it back into your pant, there's post-maturation dribbling. Post-maturation, which means after urinating, there is dribbling. So you're going to wet yourself with your urine, your own urine. So these are all symptoms of prostate enlargement. When it starts early, you know that your prostate is getting enlarged. What do you need to do to prevent this? Drink lots of water, exercise more, eat healthy, take products that suppresses inflammation, product that detoxify your system, because it's the toxins and inflammatory processes that are causing this. Drink more water to be clearing yourself of the toxins that come from your system. When you do that, your urine will be clear, white. So that the toxins don't accumulate in your system to be causing all of these ones. Mind you, the advanced stage is what we call prostate cancer. There's a difference. Prostate cancer. This can become cancerous, but I'm just talking about the enlargement for now. And you may need to have surgery, which may have certain complications that comes with it. But what we are talking about is prevention. It is 100% preventable. So yes, I know I'm entering 40 in a few years' time. I know my prostate is supposed to enlarge, but because of things I am doing now, exercise, lot of water, taking organic product that helps me, I am slowing the enlargement down. The enlargement is inevitable, but I'm slowing it down so that I don't have these symptoms. If you know anyone who has these symptoms, the person most likely has prostate enlargement. Now, let's move to the woman. If you're a woman on the call, type woman in the chat box. Now I'm talking to you. If you're a woman on the call, type woman in the chat box. Oh, Mark says we all did it. Yes. John says we all did it. Yeah. If you're a woman on the call, and I'm now talking to that woman, hey, the women are happy. Albertina from Scotland, I salute you. The women are happy. Now it's their topic. Now I'm talking to you, the women now. Menopause. Just like men cannot avoid prostate enlargement, women too. You can't avoid menopause. It will come. But the point is, the fact that you have menopause doesn't mean you should suffer till you die. No. You should know about it. It's hormonal changes. What should you do? First of all, let's talk about the symptoms. The symptoms are what we call in medicine myriad. There are a lot, all right? Lot of symptoms. Which of the symptoms can you see in the screenshot, in the picture I've projected? Which of the symptoms of menopause can you see? Put in the chat box right now. The symptoms of menopause are quite a lot. Most of them are ill-defined, unspecific, and you have no idea. Which of the symptoms can you see in the picture I just projected? Well, yeah, of course, smart lady Julia, you're saying what? Hot flashes, commonest, hot flashes, hot flashes, hot flashes. They feel heat, you know, they feel hot during the day, whatever, in that time of day, hot flashes. Which other symptom can you see? Yes, somebody said it rightly. Irregular periods, yes. Which other symptom can you see? The one I projected. I want people to see what's on the slide. What's on your slide? What's on the slide? I'll mention some of them, but I want to be sure people are following. Depression, true. It's very true. Mood swing. Oh, please, Madam Polly, you are smart. Mood swings. Mood swing. It is there. Mood swing. It is there. It is there. Mood swings. So something small just gets you off like that. You don't understand. Like, this is not how I used to be. This is it. And left touch, you can see a lot of symptoms with menopause. It's because of, hormonal changes. Yes, menopause, because of hormonal changes, you are at risk of a lot of things, including osteoporosis, which is weakening of your bone density. So let's say weakening of your bone, osteoporosis, which can result in osteoarthritis and a lot of other things. You are at risk of having certain cancers because of menopause. All right, so these are the symptoms of menopause. So what do you do when you have, first of all, you don't want to go through the ordeal of these symptoms. What you need to do is live healthy life, exercise, eat well, and take organic products that help you stay in shape. Why do you need supplementation? Because these days and age, now, let me put it out there. How many of us agree with me that the water we drink, the food we eat, and the air we breathe, there are a lot of toxins that are unavoidable? What I'm trying to say is, you just cannot avoid. Where I am, there's AC, there's air conditioning. It is not 100% healthy, but it's a necessary evil. All right? You're walking in town, you are either inhaling exhaust fumes from the cars or from factories or whatever it is. There are toxins that are unavoidable in the water we drink, the food we eat, and the air we breathe. If you agree with me that there are toxins in almost everything we do these days, put in the chat box toxins. Put in the chat box toxins. So I know you know that there are a lot of toxins. Now, we advise you strongly to eat vegetables and fruits, right? Most of these vegetables and fruits are highly chemicalized. These days, bananas don't get to ripe on the tree before they are harvested. No, they harvest it way ahead of time and then apply heat and chemicals for it to quicken its ripening. Why? Because they want to sell it quick. So chemicals everywhere. The vegetables, go to where they are grown, a lot of chemicals. The food that we are buying, tomatoes, okra, pepper, almost all of them are chemicalized. The worst form of them is called GMO, genetically modified. No, No, that one is a no-no, which we shouldn't be encouraged at all. So there are toxins all over. So the least you can do for yourself is to take things, supplement, organic products approved by FDA that can cleanse your system. That is the advice I can freely give you. All right, so there are toxins all over, unavoidable toxins, and you need to do something about it. Now, you see, there are people who are 60 years. Now, have you ever seen somebody who is 60 years but look 30 before? If you have, type yes in the chat box. Have you ever seen someone who is 60 years but looks 30 before? Have you ever seen someone who is 60 years? It's not just about the genes. It's both genes and environment. That's what happens, genes and environment. Now, there are things those people do. Yes, I know genes have a part to play, but I'm also telling you that environment also has a big part to play. Those people who are gym enthusiasts, who always spend time going to the gym on time, who eat well, exercise a lot, and live healthy life, take a lot of organic products, they live longer. I am told the Queen of England doesn't eat anything non-organic. Please, is it true? If you also know, type yes for me. I am told the Queen of England doesn't eat anything non-organic. Everything she eats is fresh, it's organic. You see why she's still living. I'm not saying if you get the fact that no, everybody will die, but you want to be in good health. That's what you want. You want to be in good health. All right. So you want to be 40 but look 20. You want to be 60 but look 30. You want to be 70 but look 40. It is possible. Regular exercise. Now, if you travel out the country, the whites, most of them, they smoke a lot, which is an unhealthy lifestyle. But you see, you know what they do to counter the effect of the smoke? They exercise a lot and they take a lot of organic products. It will surprise you. They will be smoking, but then they go and eat salad. They will smoke, but they will go and exercise in the mornings, in the evenings, and they go and eat salad. They go and eat Mediterranean salad. You see? So that's good exercises, good dieting. Very, very important, so that you can live healthy life and you can live longer. So yes, good exercise, good product to detoxify your system, because most of the toxins we cannot avoid it. Now, another problem that presents at the hospital mostly is insomnia. Now, this, I make joke out of this a lot, which I said, sometimes you'll be at work and it will look like, see, the person comes to you at dawn, 12 midnight, you are on night duty. This patient comes to you, doc, I cannot sleep. You know, jokingly, you might say, because you cannot sleep, so me too, I shouldn't be able to sleep. You might say that jokingly. But for somebody to wake up and come to the consulting room at 12:45 a.m., that should tell you truly that person is battling with sleep problems, insomnia. It's quite a big deal. What causes it most often than not? It is stress and chronic medical issues. Stress buildup. It has a lot of other mental health conditions can also cause it, including depression. Anxiety can also cause it. Depression. So if you have any mental health challenge, when we say mental illness, it's not about madness. If madness is what you see on the streets, those are people who are left uncared for. Those whose family has rejected, not taking care of them. Nobody deserves to end up like that. Anyone can have mental health illness in their life at any point in time. 1 out of every 4 human beings in the world stand the risk of developing mental illness. I repeat, 1 out of every 4. Now let me scare you a little. We are about 90 on this call. So 90, divide 90 into 4. Please do it for me. Divide 90 into 4. Those of you who went to good schools, you get an answer in 2 seconds. Close to 23. 1 out of every 4, which means we have over 20 people on this call who stand the risk. So there is no need for any stigma here. If you have any mental health, what does it include? Depression, anxiety, any other of them. Learning disability, a lot. Insomnia is one of the critical symptoms of such conditions. But aside that, we have other things that causes insomnia, such as too much stress. Chronic medical conditions can lead to insomnia. So look at this. At 3:20, I made a mistake. Let me just go on. At 3:25 a.m., this lady her eyes are wide awake. Her alarm is supposed to ring at what? 6 a.m. But as at 3:25, she's still awake. That's insomnia. Difficulty in initiating sleep, in maintaining sleep, or early awakening. That's insomnia. Difficulty in initiating sleep, maintaining sleep, or early awakening, or even intermittency, like you sleep for 1 hour, 2 hours, you wake up, 1 hour, 2 hours, you wake up. That's insomnia. Watch your stress life, watch your medical state, watch your mental state when you have this on. This is how sound sleep looks like. This is beautiful. Sound sleep. You sleep soundly. What I mean by that, when you wake up, you feel well rested. That's a sound sleep. Not the kind of sleep you wake up, you feel they've beaten you, they've gone up and beaten you in your sleep. Have you ever felt like you sleep and you wake up and feel like they've beaten you in your sleep before? Put it in the chat box. If it is yes, type yes. You sleep and you wake up, it's like somebody beat you in your sleep. And then you might say, witches are beat me in my sleep. No, you didn't have good sleep. If you sleep well, you wake up, you feel refreshed, your brain is functioning optimally because it had time to slow down its processes and put things into files and folders, long and short-term memories, and keep your body. You understand? Yes. So that is insomnia. You have. So this is how good sleep looks like. Another condition I'm going to talk about briefly is called deep vein thrombosis, DVT. I'm talking about this because it's quite common and it can be very, very deadly. What it means is blood clots in your limb. All right. Now, this is the blood flow mechanism. When you are walking, running, whatever it is you're doing, there is a mechanism for we call solar pump, for the muscle to be compressing on the vessels to make sure the blood goes back to your heart. You understand? It's called solar pump, and there are valves that make sure the blood doesn't flow back to your leg. So blood goes in the veins, it goes up to your heart, it goes up to your heart. But there's a mechanism to prevent it from coming back. Now, okay, this is explained here. So the calf muscle acts as pump for deep leg veins in your leg. So people who have had surgery, so they have to be on the bed for long, or patients who are bedridden for long, or old people who are bedridden, or anyone who is bedridden with a broken bone or whatever, you lose that mechanism of the calf muscles helping as a pump to get the blood to flow. When it happens, like the blood becomes static, stationary, so then it can clot. Once it clots, deep vein thrombosis. Thrombosis is clotting of blood. When that happens, so you see, these are the calf muscles. All right, relaxed and contracted. When it is relaxed, so you see, this person has lifted the heel like this, like that. Just by doing that, the muscles, the solar pump is into action, press on the vein, blood goes back. That's how it's supposed to be. So when you are sitting for long, the advice is, again, we are talking about prevention. Move your leg, your foot at your ankle like this. Just do it. On a bus from Accra to Kumasi, Accra to wherever, the north, on a flight, long hour flight, just do like that. You don't have to stand and even walk. If you stand and walk, it's the best. But if you don't stand and walk, you can just do your foot at your ankle, just do like that. It's very cheap, it's inexpensive, it's simple to do, but it can prevent deep vein thrombosis. Now, why am I worried about deep vein thrombosis? Because of pulmonary embolism. What that means is that blood that accumulates in that space, that clots, when it gets dislodged, after the blood clots, then you wake up and you walk, the clot will just get cut off and get dislodged and go to block a part in the lungs, and it can kill instantly. So somebody is bedridden for long, nothing is done about to prevent this. The person is now healthy, want to get out of bed and fall and dies. Somebody go to the washroom after prolonged bedridden, whatever, washroom and dies there. Somebody on a long hour flight. We lost a very prominent professor in this country on a long hour flight. He slept off, woke up and died. People will say witchcraft. It's not witchcraft. We understand. We know what is happening. You stay at one place for long without doing this, especially for elderly people. You have blood clotting. So your grandparents, educate them. It's just moving your feet like this. It doesn't take much. So encourage your grannies who can walk to walk around. If you are going to be bedridden for long in a hospital setting, Doctors and nurses know what to do. There are medications we give you to prevent this. There are ways we do this. If it is not done, just ask the doctor if that is being done to you or not. All right. So when the blood clot moves, it's called embolism. It goes to block, and causes damage, and it can kill. Now, this is very troublesome and very worrying. It's called chronic fatigue syndrome. Chronic fatigue syndrome is this. It's a complicated disorder which is characterized by extreme fatigue that lasts for at least 6 months and can't be fully understood. No, we don't know what it's causing, but you are not feeling well. You go and do all the labs, all the CT scans, MRI, all the labs from head to toe. We say everything is normal, but you are not okay. Chronic fatigue syndrome. I've seen cases like this before. I'm managing somebody right now who has this. Yes. The person has seen the physician, the surgeons, the general practitioners, the cardiologists. When the person came and I say, you have CFS, chronic fatigue syndrome. What do you mean by chronic? Like, I want to know. I say it's chronic fatigue syndrome. And these are the symptoms. There is no specific test for it. These are the symptoms. Let's go to the symptoms. It's quite myriad, all right? So you have a lot of symptoms, like undefined, or from head to toe. You are not well, but then we do all the tests and it comes out normal. That's why you begin saying it is witchcraft, but it's chronic fatigue. Now, so I've talked a lot about the problems. And we know it's because the current situation. So every problem has a creative solution. That was said by Donna Karan. Every problem has a creative solution. Now, the science is that as you age, the very thing that is supposed to protect you, to take care of your stress, your toxins levels, as you age, it begins to go down after 20 years plus. It begins to, whether you like it or not, it is truth. This is a scientific truth. It begins to go down as you age. That is what happens. And these are the benefits of that molecule. It's called glutathione. When you have enough of it, it takes care of you. It's not just about stem cells or cells the cells themselves, when they are produced, they need to be protected. So something has to protect your cell. Now, when your cells are healthy cells come together to form healthy tissues. We come together to form healthy organs and healthy organ system. That's how it works. So if your cells are not healthy, no matter how many they are, you're not going to be healthy. So if you have enough of the molecule called glutathione, you have all these amazing benefits. Your immune system is well boosted. Aches and pain will be taken care of because this is anti-inflammatory. Remember, prostate enlargement, menopause, almost all the conditions I mentioned about chronic inflammation is one of the reasons. Toxins is one. So you need something that can detoxify your system, that can stop or slow down inflammatory processes in your system. All right. Now, the bad news is, even though this molecule begins to go down after 20 years, you can't take it by mouth. I repeat, you cannot take any product by mouth containing glutathione that's going to work because it will be digested in your stomach. If anybody comes telling you there's a product that is amazing that has glutathione inside, it's a lie. It will not work because it will be digested in your stomach. And we know that low levels of glutathione is associated with over 74 major medical conditions. Now, these are free radical means toxins, meaning toxins. Now, when you have too much toxins in your system, and you're not detoxifying your system, this is how it looks like. On your brain, these are the conditions you are likely to suffer from. In your eyes, these are what you are likely to suffer from. In your heart, these are likely to. So globally, when there are too much toxins, when there is too much toxins in your system, you tend to suffer all these things. So what do you need to do? You need to be able to detoxify your own system. Drink enough water, exercise daily or regularly, take organic health products approved by international bodies, FDA, NAFDAC, or whichever body that is approved to detoxify your system. And make sure you take things that supplement your health. That's what we call them, supplements. The only problem here is that there's too much supplements on the market. And everybody says this is the best. No. It doesn't, nobody has to say this is the best. It is how you feel, what you benefit when you use it. That's what matters most. All right. So we need to detoxify ourselves because the free radicals, this is we call oxidative stress. When the toxins are too much in your system, we call it oxidative stress. You need something that will detoxify your system, that will boost your immune system, take care of your own self. Now, this is from what? PubMed.gov. Diseases that are associated with low glutathione. This is not from me, this is not from anybody. This is what verifiable from PubMed.gov. Those of you research scientists on the call, you can confirm this from PubMed.gov. Generally, it's all there. I don't want to bore you with what it is. But the solution is that you need to take things or use things that help you naturally detoxify your system. There are lots on the market that don't do anything. You spend lots of money on it. Now, before I even go on, do you know the cost of CT scan is about 600 to 1,000 Ghana cedis? Do you know the cost of MRI is from 1,000 to 1,005 Ghana cedis? And these things are good, but they are diagnostic, which means it helps us to tell, oh, you have a stroke. Oh, your bone at your back, there's a problem. Oh, your joint, that's all it does for us. Diagnostic. It's not therapeutic, but it's that expensive. CT scan from 600 to 1,000, depends on where you do it. MRI from 1,000 to 1,005. When your mother, aunt, uncle, brother, whoever has a stroke, the first thing will ask you to do a CT scan. And you have to cough up 600 Ghana cedis. Whether you like it or not, you have to cough it up. After you cough it up, the person will be admitted for at least 2 weeks. That's going to cost you over 1,000 plus. Then if we don't see what we want to see, we'll ask you to do MRI. You have to cough up another 1,000, 1,005. Now, who on the call has been asked to do CT scan before? Please put the amount you see. Please put the amount in the chat. Who has been asked to do a CT scan for themselves or for anybody know, or MRI? Put the amount you paid. I said it. It's 600 CT scan of the brain. This is how much you pay for a diagnostic investigation, which we need to help us know what condition you have. So instead of waiting for your uncle or brother or sister to have a stroke, for you to cough up the 600 Ghana cedis emergency, MRI is 1,000 Ghana cedis. 1,002. MRI 1,000 exactly per scan. Look at that there. You will cough it up whether you have the money or you go and borrow. So why would you do things that will prevent the condition? That will prevent the severe osteoarthritis. That will prevent the severe prostate enlargement. That will prevent the stroke. Why won't you do that? That is why, as I'm ending, I'm here to advise you on. So the solution is something you know of, but you may not know that it is what can help you because there is too much out there. Would you believe there is a medical breakthrough and has been with us for over 8 years? In fact, it's been around for 15 years. Been in Africa for 8 years and it is spreading. The solution is not to give you glutathione, but to give you something that your own system needs to produce its own glutathione. Mind you, when I told you that when your level begins to go down, you have these conditions that comes with it, and you cannot take it by mouth. So how then do we help you? You need it, but it begins to go down after 20 years, and worse of it, you can't take it by mouth. So the breakthrough came after 25 years of research, when the professor, an American, Japanese-American, discovered this amazing natural molecule, nutrients called ribosine, which gives your own cells what it needs to produce its own glutathione. It doesn't have glutathione, but you're able to produce your own glutathione naturally. And this very, very expensive product, extremely expensive, but I can vouch for it because what? I use this product daily for myself and family and relatives, and it's good. But it's very expensive. It boosts your immune system, detoxifies you, and takes you off your aches and pain. Most of you know about cell GPT already. If you have ever used cell GPT and you have any testimony to share on the call, for people who don't know about it, please share in the comment section. If you need it, get in touch with any of your friends or myself. You're going to get it. ATP, very powerful. These are all products that helps you boost your immune system. And ladies like this one because it takes care of their hair, their nails, and their skin naturally. A complete blend of omega-3, omega-5, and omega-7. Hair, nails, and skin, and of course your heart as well. Blemishes, I'm a man, but you see my face is smooth. So a lot of ladies like this one. All right, so if you need any of this, get your friends in touch. Get in touch with me or your friends, and you're going to get it back. What we are talking about here is prevention. We want to make sure we don't end up with enlarged prostate. We don't end up with too much severe symptoms of menopause. We don't end up with stroke. We don't end up with too much chronic back pain because we're going to do things that will help as well. All right, so at this point, I'm going to open up and I'm going to ask anyone who has any questions to, if you have any experience with any of the products, please feel free and share. I'm just recommending this with my credibility as a medical person, because I've used it. I use it a lot. Some of my friends and family uses it. So I can tell you that, okay, there are a lot of products on the market that people are going to promote that it helps to boost your immune system. You know, we're in COVID era. Viral conditions are not curable. COVID-19 is not curable. Common cold is not curable. HIV is not curable. Hepatitis B is not curable. These things are not curable. But when you take things that boost your immune system, yes, I mean hepatitis B is not curable. Just like asthma and hypertension is not curable. Diabetes is not curable. Don't be deceived by the spiritualists and the herbalists. Listen to what is truth. All right? Now, but you need to take things that boost your immune system. That lets your system take care of it. So COVID-19, if you have it, if your immune system is very weak, you will end up with complications or you will die. But if your immune system is good, you'll be able to go through it. All right? So yes, hepatitis B, common cold, all this viral stuff, they are not curable as of now. So don't let anybody deceive you. They just want your money. All right? They just want your money. If anybody has any special question based on any health issue, you realize I'm talking about only medical issues. There are surgical issues that I don't want to touch on yet. But let me just briefly touch on one. Fibroid. It worries a lot of women. Don't be deceived by anybody that there's something that will shrink your big fibroid. No. Let the gynecologist help you with the surgery that is required. All right? There are a lot of other surgical conditions that in the due time, I'll have surgeons come over to share with us as well. All right, so, all right. Any questions, put the questions in the chat box and I'll help you. I am only recommending what I know works, and I'm telling you what the conditions are, how we can prevent it. Chronic back pain, sit upright. Sit upright and don't be curving yourself too much. Prostate, drink lots of water, exercise, take organic product that detoxifies your system. Menopause, take product that boosts your immune system and clears your system of the toxins. When there are a lot of toxins in your system, we call them free radicals. Now, varicose veins, okay, let me start from Mabel. Varicose veins, you need to see the surgeons and they will advise you accordingly, all right? How do we treat varicose? That's, yeah, so varicose veins, you need to see the surgeons. Again, when I say see the surgeons, please go and see the surgeons. How do you deal with constant anxiety and palpitation? Thank you very much, Mr. Nana Kwame. When you have anxiety, you need to just see the psychiatrist. You need to be assessed, and we know what it is you are going through. There are medications to help you alleviate your symptoms and help you be better. So thank you, Nana Kwame. See any doctor at any facility near you. If you want to get in touch, you can link up with me on WhatsApp or Facebook, and I'll guide you as well. So if you have anxiety or whatever, see the appropriate. Okay. Yeah, so Mufaro, the question asks something that can boost your immune system, detoxify you. I will boldly recommend to you Celgivity and ATP. For men, the best combination is Celgivity and ATP. Very expensive product, but very, very effective. ATP gives you natural energy, it relieves your fatigue and takes care of acute pain like migraine or a menstrual ache. That's ATP. So when you add it to Celgivity, powerful. For the women in general, because you like your skin, your hair, and your nails, Celgivity and Max 357 for the women. Again, the combination is quite expensive, but if you can afford it, go for it. Health is not cheap, it's expensive. Something to detoxify your system, to boost your immunity and take your aches and pain for yourself, your family, your friends, please go for the combinations if you can afford. If you can't afford a combination, at least use this one, Celgivity. Contact your friend who asked you to join this call or myself, and we will get it for you. If you don't know who to contact, just link up with me. This is my WhatsApp line, my call line, anytime. So Nana Kwame, you're asking about anxiety and palpitations, you can link up. I will guide you which hospital to go to. There is help for any condition that you might have. Don't listen to anybody who is not qualified. So seek the necessary help and you will be relieved. Don't go taking help that are not approved. No. So this is my contact line. You can get it. Chat me on WhatsApp or call me up. I prefer chat actually. So these days, man is busy. So chat me on WhatsApp. I will guide you where you can get help with anxiety or depression or whatever condition you might have. Any surgical conditions, you need to go see the surgeons and, of course, deal with it surgically. Any more questions, please? Okay, so Antonio says I should show the products again. No problem. I'm happy showing them. This is Celgivity. I recommend it because I use this. ATP. My auntie, biological auntie, has migraine and she's been using this. Migraine is not curable. Let me mention some of the conditions that are not curable. So nobody go deceiving you that come and take it, it's going to cure. No, there's no cure. But you can take products and medications that are going to give you optimal control. When a doctor prescribes medication for your hypertension or diabetes, it's not to cure it. It will give you optimal control so that over time, we can reduce the number and dose of medication that you are on and you'll still be fine. So yes, Celgivity, ATP, 357, GXL, all the others, I'm just giving you samples for you to know that there are amazing organic products approved by FDA that really work. Expensive, very, very expensive, yes, but very, very effective. All right. Any other question? How do I treat chronic fatigue? Okay, with chronic fatigue, again, you have to get in touch so I know what the problems are. But generally speaking, if you are male and odopoku mensa, you can take Celgivity and ATP. Celgivity and ATP and give me feedback. Women, Celgivity and 357 again. Please, what causes burning sensation all over the body and severe nerve pain all over the body? That is what we call the neuropathy. The neuropathy is coming from a lot of causes. It could be the vertebral column is compressing on the nerves that comes out. All right, and not coming. So those who want the product, just contact your friends, take pictures of the product. Let your friend. If you don't know who to contact, this is my number. I want to show something to Nana Kwame very briefly. So take my contact, reach out to me, and I'll link you with whoever you can get the products from. All right, at the good prices. Now, Nana Kwame, let me show you something. I talked about this earlier on in my presentation. If you notice, I hope it comes up quickly. I don't want to keep your hand. The nerves. You see the nerves come up from the side of the vertebral column. So if there's a compression along any of these lines, you can have the nerve problem. If you have diabetes, which is poorly controlled, you can have nerve problem. So it can come from a lot of things. All right, Nana Kwame. All right, okay. How long must a person be bedridden to be at risk of DVT? It's not specific how long, but as long as the person is going to be sedentary, even if for some few hours, if the person can move the foot at the ankle joint, please advise that. If the person is on admission in a hospital, there are medications we give, Clexane, heparin, and all that we give them. Okay, there are things we do in a hospital. But if it's at home, the simplest thing is, let's say the person getting out of bed regularly, moving the foot at the ankle joint, and taking small walks. If you are obese, you are at risk already. If you are sedentary, you are at one place for long, you are at risk. If you have diabetes or what, you are at risk. So just make sure you do the simple thing that are advised. If anybody has stomach ulcer, it is advised to see the doctor. You'll be given medications we call PPIs and other ones. Those that are antacids and all that. All right. If you want to take any of our product, you can go for Enfuse. I didn't project our Enfuse and Max 1. Enfuse and Max 1 will help you greatly. So Susanna, Tai Bobo, yes, you can take my number. We'll chat on WhatsApp. I recommend to you and I'll link you to whoever you can get it from. Enfuse and Max 1 will help you very greatly. Now, ulcer means that you have a lining in your stomach. I should have added that one to one of my slides. So I added it on the next presentation. Ulcer means you have a wound in the lining of your stomach. So when you don't eat on time and the acid is produced, the acid entering the wound is what makes you feel pain. All right. So that's ulcer in a layman's term. All right. Can lactating mothers, I saw some question like that. Can late eating cause high blood pressure, high cholesterol? Of course, if you eat late, the food is not properly digested and you go and sleep. The buildup of that, yes, it's a high risk for that. So you need to exercise regularly. Late eating is not advisable at all. It's not advisable because you need to have time for the food to start digesting. All right. So the best is experts. And most of us are all corporate to that, but the best is you eat by 6, 7, you've eaten your dinner. If, strictly speaking, we are not even supposed to eat after 6 or 7. Yes. But sometimes you come back from work late and you're hungry and all that. So yes, it's a high risk for high blood pressure, high cholesterol, and diabetes. Yes, our eating habits is what it is. All right. And I hope I've answered you. How long can a person answer that? How long can one take Celgivity? As long as you want to take it. It's organic product. It's works with your system. It's not chemicalized. It's all organic. I've been using it for 8 years now, since 2014. My relatives are all using it. This Monday, I'm going to send some to my grandfather who is in his late 90s in the village. My auntie, so as long as you want to. But I will advise, take it for 1 month, 2 months, 3 months. Give us feedback, and then you can reduce the dose. You don't become dependent on it. So after 2 or 3 months, you can reduce the dose to reduce your cost. Yes. So there's nothing like tolerance. There's nothing like dependence. So you can take it 2 or 3 months. Your system it's not kicked into action, and whatever is going on, you can then reduce the dose to half your cost and take it as and when you want. All right. If you miss doses, nothing will happen to you. You're not going to have withdrawal symptoms, no tolerance, no dependence. All right. Very, very safe. And good things approved at NAFDAC in Nigeria, FDA in Ghana, approved in Ivory Coast, Kenya, Cameroon. It's all approved, and people are using with great benefits. I have to tell you, because people are using it. All right. Someone, any more questions, please? Any more questions? If anybody have any experience with longevity, any testimony you want to share, please put it in the chat box. I have 2 minutes more to get to close the call. Thank you all very much for making time, staying with us till this time. All right. Anybody has any more? Somebody has a question up there. Let me see. Nana Kwame, I have a YouTube link, but I didn't, I may upload it. So yes, I have a YouTube link, but I will get an expert to help me extract the videos from this recording so that I can upload. Thank you very much for the idea. So I will get an expert to extract this video for me, and I'll upload it on my YouTube channel. Thank you very much. I'm sure that's my senior from Facebook, Mr. Nana Kwame. Thank you very much. Yes. A lot of people need this. So yes, it's Dr. Albert here on YouTube, but I have not shared anything there yet. So I'll get somebody to extract this content for me and I'll upload it. Thank you very much for the idea. Thank you very much. I appreciate it. Yes, that's a big man, Charlie. All right, guys, thank you very much for making time. If you learned something today on the call, just put in the chat box. I don't know what you should put in the chat box now. Put anything in the chat box. Put anything in the chat box if you learned something tonight, just for me to know that you learned something. Put anything in the chat box. Anything that comes top of your head, anything that comes in your mind, anything that comes into your mind, put in the chat. I came with myself and it be very, oh, okay, good. Oh, Albertina in Scotland, you are using LGBT. You're in Scotland. Well done. And it's been very grateful. Oh, very helpful. Nice. Then. Yes. So prostate enlargement, I'll recommend Solgivity and ATP for you. But of course, don't forget to go to the doctor, do the necessary test, and follow the advice of the doctor. These are products you can take alongside prescribed medications. If you're not sure what to do or what to take, you can always link up with me on WhatsApp. Best is WhatsApp. I do most on WhatsApp. Calls I will pick, but Charlie, these days, man is multitasking every 5 minutes. So if you chat me on WhatsApp, I will recommend for you. Our old people, if they fall sick and they are admitted, you will spend on them. So let's make sure they stay in good health. All right. Menopause and prostate enlargement. For the women, I'll give you Solgivity and 357. For the men, I'll let you go for ATP and Solgivity. It's helping a lot. Yes, I'm here right now. A very rich man in this country is ordering for 2 months supply of our product for the mother. The mother is 74. And until they met me and I recommended this product to them, they were going to the hospital, expensive hospital, first-class hospital in this country, spending lots of money. But since 1.5 years now, the woman has not been to the hospital. She's very well, doing well at home. Yes, very expensive, yes, but it's less than 1,000 Ghana cedis, the combination, and it's also less than 500 cedis for the individual purchases. But I can assure you of the benefit that you're going to get. All right, thank you very much for sticking and staying with us. I appreciate it. All right. Oh, early diagnosis is the first cure. Yes, thank you. Early diagnosis, early recognition, early detection. So we detect early that you have hypertension. There's something we can do about it to keep it low. We detect early that you have diabetes early. We detect it early that you have something, even prostate enlargement. We detect it early. But men, we're supposed to be checking our PSA. It's called prostatic specific antigen. So PSA regularly, at least yearly. It should not be more than 4 nanograms per, forget about the medical jargon, but there's a range it's not supposed to go above. Early detection is the first cure. Thank you very much, Mr. Nana Kwame. All right. Oh, John, thank you very much for the compliments. I appreciate you. And thank you, of course, for making time. And I'll get the recording available, the Zoom recording, of course. And Mr. Nana Kwame has given me a very brilliant idea. I will extract the video and upload on my YouTube so that people can go back and listen and and have accurate medical knowledge, so that the herbalists and the spiritualists will stop deceiving people. All right. Okay, Albertina says she's learned a lot on menopause. You see, very good. All right, yes. So I'll extract and share on my YouTube link. I think that'll be my first educational content on YouTube. And thank you very much, Mr. Nana, for the brilliant idea. You see, two heads are always better than one. You understand? I told you I'm also going to learn. I'm also here learning with you all. I'm doing this again because there's few people who are doing it, and a lot of people don't know anything about what they are even going through. Their parents have stroke, they have hypertension, diabetes, they don't know what to do. So once again, thank you very much. If there are no more questions, I would like to. So if you have any questions, any whatever, that's my WhatsApp line. Reach out. Facebook, I'm called Albert. Settle here, Albert. And now through the Nakomi's inspiration, I'll be activating my YouTube link. I have it, but I've not done anything there. And I hope to do this regularly. It won't be me presenting all the time. I'm going to have other experts joining us. Next, I'll have a dietitian teaching us what we should eat and what we shouldn't eat and when we should eat, the expert in that field. I'll have physician specialists. I'll have surgeons. I'll have gynae specialists. I'll have gynecologists. I'll have, and these are all people you have to pay before you see them, but because we are friends, it's a fraternity. I'm a specialist psychiatrist. So I'll work with my friends, my colleagues, and we'll give you free content all the time. I hope to do this regularly, weekly, as much as possible. If you would love me to do this weekly, type weekly in the chat box right now in capital letters. If you want me to do this weekly, I want to be sure I get more than 30 weekly, then I will do it weekly. Because it takes a lot of preparations to do this. If I get 30 weekly, I will do weekly. Because I'm quite busy, but I'll make time to sell. So if I get 30 weekly, I will do it weekly. Because I have friends who I can always call to join us. All right, for 30 minutes, they can spare their time because we are colleagues, we are all specialists. And I'm not just going to call just anybody. These are specialists in their field who know what they're talking about. All right. If I get more weekly, I will do it. Weekly. All right. I think consensus, the weeklies have it. So I'll try. I'll make sure I live up to the time. It's 4:30 p.m. okay for everyone? What time do you think is best? Is 4:30 okay for everyone? Let's just do a simple survey here. If 4:30 is okay for everyone, type yes. Is 4:30 okay for most people? Not everybody do, but most people. If yes, if I get a lot of yes, I will stick to the 4:30 p.m. Because consistency what result in great outcomes. Consistency is not just once in a while. Yeah. Okay, so 4:30 it is. Weekly it is. All right. So hope to see you next week, Saturday, God willing. Once again, it's been a plum pleasing pleasure serving you all. Have a lovely evening, every one of you.